some tips for effective communication with the advocates in your group. I think it's important to encourage the patient advocates to share their thoughts on the study's main takeaways. This will likely generate a lot of questions and discussion. Definitely leave room and space for the advocates to talk. It's important to take big breaths, take breaks as you're explaining these concepts and allowing the advocates to process the information. If you're unable to answer a question, just be honest and say, I don't know. It's actually quite refreshing for the advocates to realize that the scientists are not experts in everything. And you can always follow up with the advocates after the session to answer any unanswered questions. It's important to identify the experimental design. So that means, is it preclinical research? Is it a clinical trial? Is it an interventional trial, observational? You can further classify the research by whether we're testing a certain treatment, like a drug or a biologic. Is it a quality of life study? Are we looking at genetics or genomics? Is it epidemiological, symptom management, supportive care? So lots of ways to kind of classify the experimental design. And then it's important to provide background and context to the key scientific concepts. So for example, explaining the trial design rationale. The poster tells a story. So what experiments are used to tell that story? And it's also important to help interpret what type of science is being communicated. So graphs and curves, for example. If you're presenting like a Kaplan-Meier curve, it's important to describe the X and Y axes, significance of the curve steepness, the distinction between OS and PFS, and why all these terms matter. And it's also important to clarify any technical terms. So words like molecular profiling or epigenetic testing, these might be completely routine words that you use in your day-to-day as a scientist, but they are really foreign to patient advocates. So just do your best to explain any kind of scientific words or concepts. Some of the frequently asked questions we get from the scientists are, how do I register for a GRASP session? So it's pretty easy. You just have to become a member first. You can go to our website at graspcancer.org/join us. And actually, for you guys, it's really easy because we actually register both the scientists and the poster authors on the back end. So you do not need to register yourself. You'll receive an email if you're a member to let us know your availability and interest in joining a future poster walkthrough. Once you have agreed that you can serve as a scientist or a poster author, the next question is, where do I find the Zoom link to join the GRASP session? So once you are registered for the conference, you will receive a confirmation email from GRASP at graspcancer.org. And this will have all the information you need, including the date and time of your session, an invite to add to your calendar, and the Zoom link. So just make sure GRASP at graspcancer.org is like in one of your safe recipients so you can receive our emails. The next question is always, where do I find my assigned posters? So all the assigned posters will be posted as PDFs on the first day of the conference. So that's just good to keep in mind that they won't be available until the first day. And they're posted at graspcancer.org/posters. You can also access the posters from your member dashboard at graspcancer.org/dashboard. We'll also be sending you emails, so we will not let you miss finding your posters, but these are ways you can do it without having received the email. And then a really good question that we often get is, are scientists and poster authors expected to create presentations? So the scientists are definitely not expected to create presentations. If you want to break up your poster, for example, into different slides, that's okay because it just makes it a little bit more visually appealing and easy to read, but there's no need to actually recreate an entire presentation. Most importantly, we want you to remember that these aren't really presentations where you're talking at patient advocates. It's more of a discussion and a conversation that should not be one-sided. We really want to foster that bi-directional learning between the advocates and the scientists.